So I'd like to start off by saying welcome to the 2022 Evening of Inflation. It's an event that's coming to you when prices are on the rise, and the money you spent on gas to get here is probably more than you spent on your sponsorship. But don't worry, we're raising the prices of the sponsorship. So we're excited to be back in live again. Our last Evening of Innovation was held in the before times of 2019, when handshakes after sneezing were legal and the Academy Awards were a safe place for comedians. My name is Scott Agajanian. I love this table over here. I love you guys. My name is Scott Agajanian. I'm the Director of Economic Development for the City of Murrieta, which, woo, which I know surprises most of you, and none of you more than this table right here, the City of Murrieta table. So this is a night of innovation, the creation that comes from taking a thought or an idea and turning it into something real or useful or tangible, like Patrick's idea to grow a beard, which has now become sentient and taken over all of his body movements. The Evening of Innovation celebrates our regional talent, the work they've done to push their concepts forward towards commercialization. Tonight, you will hear a variety of life science startups present their businesses to you, and I certainly hope at the end of this, you walk away about as optimistic as I am for the growth of our region. Thank you for joining us this evening. But before we get too far into this, I'd like to start by thanking our sponsors for this evening's event. Your generosity and support provide us the opportunity to grow the life sciences ecosystem here in Southwest Riverside County. So when you guys hear us announce you as a sponsor, would you please cheer? Don't wait all to the end. Don't wait. When you hear your name, cheer like you mean it. So we're going to go through all of our sponsors, starting with the event sponsors. So starting off, we have California State University San Marcos. That is my alma mater. And I'm sorry to say that because I feel like it brings you down, but in reality, I loved going to your college. I hate to say I went there because I don't think people want to follow me, but it was a fantastic school and a great university. We love you guys. Next up, we have the City of Murrieta. After tonight, probably also my alma mater. First Republic Bank. You're out there. The big table, Loma Linda University Medical Center Murrieta is here. The party table, Metropolitan Water District, has been making a lot of noise here tonight. Perkins Coie. Coie. You're here? And Swenson Advisors. We also have table sponsors. Our table sponsors are the University of California, Riverside, the Western Municipal Water District again, now we have Southwest Healthcare and Temecula Valley Hospital, my favorite two UHS hospitals, the County of Riverside, the Southern California Gas Company, and now we get on to our partners, the Murrieta Innovation Center. They have something to do with tonight. InSoCal Connect, Impact Southwest Riverside County, UCR's Epic Small Business Development Center, Angel Launch, and your one and only Murrieta Wildomar Chamber of Commerce. We also have some dignitaries that we would like to highlight and thank and recognize for being here, starting with the, well, we're going to skip this one, starting with, well, that's our keynote speaker, should be here in a little bit, starting with the mayor of the City of Murrieta, Mr. Jonathan Ingram, our Murrieta City Council member, Mrs. Lori Stone, another Murrieta City Council member, Mrs. Cindy Warren, representing California State Senator Melissa Melendez, we have Amanda Fisher, representing California State Assembly member Kelly Ciarto, we have my favorite export from Iceland, Hildur Sam, from Western Municipal Water District, we have the very shy board president, Brenda Denstead. We also have the Temecula Valley Chamber of Commerce President, CEO Brooke Nunn, if I saw you here. The Executive Director of the Economic Development Coalition, Mrs. Connie Stouffer. Connie, thank you for all the French bread pizza. We love it. And there's a couple others. Christopher Earl, I have to pull out a whole piece of paper on just because of his title. The Acting Deputy Director of Southern California Regional Advisor, California Office of Small Business Advocate, Christopher Earl. What did you do to get a title like that? And of course, we have the Lake Elsinore President, CEO, Kim Cousins. And finally, in the back of the room, we have a man who left himself off of this script, but he needs to be recognized. He is the Princess Buttercup to my Dread Pirate Roberts. He is the Mr. Wonderful of this Shark Tank production. He is Mr. Patrick Franklin Ellis, the President and CEO of the Marietta-Wildomar Chamber of Commerce. So dignitaries, thank you all for joining us. Now, since we're all here and we're live and in person, we thought we'd prepare a video for you featuring most of the same people that are here live and in person with you in this room. This is now a standard event practice. We'd like to showcase just a little of the special things that are happening at the Murrieta Innovation Center. So let's all take a few minutes to just MIC and chill.
Murrieta is one of the fastest growing regions in California and is becoming a super regional hub for healthcare services and life science innovation. The city of Murrieta established healthcare as a major focus in economic development over a decade ago, and the result has been decisive. Murrieta is the medical engine of Southwest Riverside County.
So the city created the Murrieta Innovation Center in order to provide a home for startups that didn't have a space to grow and develop in. So the purpose of the Innovation Center is to create a life sciences hub where startups can get together, work and share ideas, and grow to build their business into something that can spin out into the community. The real plan of the Innovation Center is to take that innovation that's here in our valley and all the talent that's here and give them a home or a hub to start their business.
Home to major medical centers such as Kaiser Permanente and Loma Linda University Medical Center, Rancho Springs, and Rady's Children Health Services, Murrieta continues to grow its healthcare landscape with several development and expansion projects on the horizon.
What's unique about the Murrieta Innovation Center, as far as I know, we are the only biotech, health tech incubator within Riverside County. That makes us extremely unique, and I think also positions us very well to help those types of businesses grow and sustain the ecosystem that we're working on here.
We are just getting started with the innovation that will come out of Murrieta. We're incredibly proud to have received a $3 million grant from the U.S. Department of Commerce to support a new wet lab, a clean room, a new dry lab, and the renovation of existing office space and conference spaces at the Murrieta Innovation Center.
With the addition of a wet lab, the center will have everything life science innovators need to kick off their startups.
We selected Murrieta Genomics as the home for our startup for a couple of different reasons. One, because it's centrally located between Los Angeles and San Diego, which allows us to draw on both talent pools from both Los Angeles and from San Diego. Two, because we also have the opportunity to have a lot of people that commute back and forth to both of those locations. So we really have a highly educated community that lives here that actually works in the biotech and biomedical space that is already existing as a talent pool to draw from for employment.
Investors might not know that this is the perfect place to invest, and it's because a lot of our businesses are untapped. There are startups out here that haven't been seen by all of the Silicon Valley investors, and so they're really your first stop to look for new investment opportunities. If you're looking for deal flow, the Murrieta Innovation Center is filled with life science companies that have not been heavily invested in, that are ready for venture capital. Some of them have already received some, but you can get in an early seed round and really find an opportunity that you wouldn't have found otherwise. The Murrieta Innovation Center is the home to innovation in our valley, and it is the most successful incubator in Riverside County.
Now is the time to invest in healthcare and life science innovation. Now is the time to invest in Murrieta.
There's nothing like seeing your enormous chin up on a screen in front of everybody. Wow. So the Murrieta Innovation Center is something that we're really proud of. It started about 11 years ago, as Kim Davidson was reminding me. And it really started with the support of our city council. They had a lot of options that they could have placed their trust in. That building could have been used for a lot of different purposes, but they chose to really invest in biotech growth in our valley because we wanted the growth of jobs and we wanted the opportunity to provide new job choices at home. And so this has been a very long process, but we're so happy to see the successes that we're having. The U.S. Department of Commerce doesn't just throw $3 million at any project. They really chose this region because of all the resources that we have working there. So we are very, very excited about that, and it wouldn't have been done without not only our city council, but also the fine work of the people in the Innovation Center. Your incubators are only as strong as the people that are working in there, and we have phenomenal startups, as I think you're all going to see tonight. So we're going to go a little out of order right now, and we're going to start doing some pitch presentations. Now, usually, if you watch an episode of Shark Tank, you'll see 3 pitch presentations come up. Tonight is going to be the Twilight Zone marathon of pitch presentations, because we loaded up a dozen for you. Now we're down to 11. One of our virtual ones couldn't make it, but we're going to have rapid-fire pitch presentations for you here, just showcasing all the different talent that we have in our Innovation Center. So to get started, we have our anchor of the center, which is Myriad Genomics, and Mr. John Powers is going to come up and present for you.
But thank you all for taking the time out to come hear about what we're doing in Murrieta. So I want to start talking about the Innovation Center and really what they've done for us with Murrieta Genomics. Murrieta Genomics is an incubator company, and this started with the 3 of founders, Brandon Young, Jay Goth, myself. The inception we had of Murrieta Genomics was to facilitate opportunity and innovation, not only in genomics, but for business in the region. When we looked at launching Murrieta Genomics, genomics was big. It's been growing for the last 2 decades, but a lot has really changed. And what we're looking to is really drive more genomic use for new science everywhere in the region and really come up with some real novel ideas. So how do we accomplish this goal? With the ongoing support of the City of Murrieta and the region, we've been able to offer lab services and professional expertise across broad business and science ideas. And the incubator companies, I'll go through later, we've been able to really save them a lot of upfront and a lot of cost coming in where they really wouldn't have the resource to bring in the overhead that's needed to run an incubator, and not an incubator, but to run a genomics lab. So that's what we provide. We provide the lab, the testing, scientific expertise, business expertise, and we also have a very strong advisory board that really does a lot of pro bono work in legal, accounting, and all business services. And we've really kind of run the gamut. We've had people come in that have good backgrounds in science or good business backgrounds in a science idea, and help them develop that into a real business. And when I put the lab, we've got a lab picture here as well. So we obviously cut out overhead salaries. This is just the sequencers. So this is just 1/3 of what the lab is. So when we look at our model, the goal is to eliminate a lot of overhead that a lot of the small companies really can't, a lot of these companies wouldn't even have a business if they had to spend the money to do this themselves. We've invalidated the science for them. So we've had people come in that have great ideas and they've done some testing, and we help them a lot on the science side. So Brandon is very strong at helping on the science, doing the testing, recommending testing, and models to run from a start concept to a full product. We validate the business model on the business side with Jay and myself, who have much more operations and business experience. And then we send them out as fully baked companies. And like we said, we're early in the process here. And with the interesting thing is with the pandemic, it really set up doing this much more virtually. And we found that that actually works very well. Because a lot of our testing, we don't need to have people in the lab to do it. We can get direction, we can run tests, we can share results, we can do Zoom calls, and it's really worked well for what we set up with Murrieta. And what's the secret sauce? What makes this work? We've got a strong management team, we've got a great advisory board. It's 20 strong with very good, high-level scientific minds, business minds, lawyers, accountants. I separated lawyers from business minds because it's a different thinking. Any lawyers in the audience, I apologize. We've got great collaborators, and we can help with investor relations as well. So when we look at companies we've worked with, you'll hear from each one of these individual companies this evening, so I'm not going to go into much detail. They all have very unique ideas and very different approaches, and it really shows some of the diversity that we've really brought to the region. And the goal is to have, as we spin companies out and as we grow the companies, to provide more and more businesses filling space in the region. So I want to thank you very much, and if you have any questions or ideas, please feel free to reach out to us. We've got business cards on the table outside, and I'll leave you to the next presentation.
And that was Myriad Genomics. Next up, we have Helen coming up from TX Genetic Research. And she will tell you why I should never eat a salad. It's fantastic science.
Thank you to everyone who's worked so hard to make this night of innovation a success. I'm Helen Harrison, and this is my wonderful husband, Robert Backstrand. Yay. Our stories start with our individual genetic inheritance. I developed interstitial cystitis, and our website recounts how I used genetics and nutrition to overcome it. Bob developed chronic fatigue syndrome, and tonight I'll focus on his experience. There we go. I'll be throwing my papers here, so don't mind that. Chronic fatigue is a complex, degenerative, and debilitating autoimmune and energy deficiency condition. It can involve pervasive fatigue, cognitive and memory impairment, muscle and joint pain and degradation, and many, many, many other symptoms. Researchers understand the biochemical changes that occur in CFS, but they don't have a clear picture of the genetic contributions. Unlike others, I have a genetic variant profile that appears to predispose someone to chronic fatigue syndrome. I also developed a nutritional protocol that helps decrease the impact of the inflammation and the fatigue. Now, a very unique personal circumstance enabled me to do this. I know well 3 generations of fatigue in my husband's family: his grandparents and his great aunt, his father, and Bob and 2 of his siblings. And as you can see, by looking at the last column with Bob and his siblings, all of them meet the CDC criteria for chronic fatigue syndrome, but my husband has well times more the number of symptoms than his siblings. So I sensed genetics had to be the reason he was more impacted than his siblings. Now, this is only one family out of millions. According to the CDC, up to 2.5 million people in the U.S. are diagnosed with chronic fatigue syndrome, 80% of whom are women. The CDC believes that about 90% more may be undiagnosed, and worldwide, up to 22.5 million. The future for CFS patients is now generally bleak. About 40% never recover within 6 months of their health crash. 40% never recover, 60% never do. The average age of death is 58.5 years, and studies show increased risk of suicide. TX Genetic Research puts the science of nutrition to work for people with CFS. We provide precision nutritional genomics services and products. Chronic fatigue syndrome folks are very sensitive to foods and drugs. A customer's genetic profile reveals what nutrients and chemicals they cannot tolerate. These are excluded from their custom supplement protocol. If a customer does not have an advocate who can help them manage their protocol, TX Genetic will pair them with a nutritional coach. We have testimonials from people that we have helped so far. There are 3, but I'll just read one of them. Not too long ago, I was immobile and sleeping most of the day. I am now employed with a very demanding job. This is strictly due to the guidelines that I got from Helen regarding food and supplements. On to the next. The similarity of chronic fatigue syndrome to COVID-19 long haul is well known. This suggests a market much larger than only CFS patients. 339 million people have contracted COVID-19 worldwide as of 2021, and about 25% of chronic 19 patients develop long haul. They are comparable disease profiles. They share about 24 major symptoms. They both have autoantibodies to neurotransmission receptors, and they both have damage from oxidative stress. So, where does TX Genetic go from here? First, we want to get our nutritional supplement manufactured and distributed. We want to extend our genetic analysis to more CFS and possibly COVID-19 long haulers. And last, we want to create a website for business enterprise, health consultation, and community support. Thank you very much for listening to TX Genetic Research.
Great. So I'm talking about organoids. And what are organoids? Basically what we can do is we can take stem cells and create mini organs, like a brain, a liver. And this is a new technology, and it's really pretty cool. So what we can do with these organoids is we can actually use them for testing on human systems on a computer chip. So it's called organ on a chip. This is really advanced technology, and NeuroBlast is actually one of the leaders in the field. So one of the important things that we can do is, instead of testing on animals, why not test in human systems right away? And by using these mini organs, we can actually test the effects of drugs, pathogens, any kind of activity in an actual functioning human system. That's very cool, because now you're not hurting people, you're not hurting animals, but you're getting even better results than you would normally. So far, NeuroBlast has been able to build out mini brains, lungs, livers, immune cells, and gut organoids. And when they showed me their gut organoid, I was blown away, because they actually have a gut organ on a chip that actually oscillates. It actually moves food through the system. I mean, mind-blowing. So one example is their mini brain. They can actually create a mini brain that has all the central nervous system components, including all the cells and the blood barrier. So you're not just testing neurons, you're testing the whole system. So obviously there's going to be a lot of money thrown into this area. Right now we're looking at about $17 to $20 billion being spent on organoids, but it could be $150 billion very, very soon. This is the great slide that I love about this presentation. If you take a look at some of the leaders in the field, like MilliporeSigma, that's here in Murrieta, Takara Bio, you'll see that they all have one or two pieces of the puzzle, but only NeuroBlast has put the puzzle together. So they've been able to do this through non-dilutive funding, mostly grants from people like the Department of Defense, DARPA, NSF, and we're putting together something that's going to be really, really special, and we're very proud to make Murrieta the centerpiece for this. The science team comes from all over the place. Ainun and Alex are the founders. They're traveling today, so they asked me to give the presentation. But they have experts in the different fields, and you really need a strong scientific team to really put this together, and I'm helping them on the business development side. This is the contact information, and anybody has any questions, feel free to contact myself, and I'll put you in touch with the real geniuses behind this company. Thanks.
So apparently I completely lied. We are flying through this. My goodness, this is rolling fast. So next up we have Pankaj from Gattaco. coming on up to give you a quick demonstration about a wonderful product they have.
Well, thank you for having us here. I'm new to actually Marietta. The two founders of Gattaca Technology are here with me, but I'm representing the company and wanted to also acknowledge that we have really been taken over the Marietta Innovation Center slowly and growing. So it's been a great experience to have that space for a startup company to really nurture and grow. So thank you. I was going to start off by saying we can all feel, it's not happened yet, but we can feel it, that healthcare is slowly moving closer to the home. We're seeing it with all of us maybe either doing it or knowing someone who's done a telemedicine virtual call. We have seen it with COVID at-home testing that all of us have probably done by now. And really this market is taken off for multiple reasons, partly because of the pandemic. And that's the silver lining, maybe we can say, is we all wanted something like this to happen. And you can see that an example of the telemedicine market, $90 billion, and projected to grow really fast. The challenge is we're still only talking about COVID testing, maybe some flu testing with swabs, but really 70% of medical testing is blood-based. And we all know it because we all go to the doctor's office, get blood drawn, sometimes once a month, sometimes twice a month, depending on if you have some pre-medical condition. So all of this today is being done with blood, but blood testing is complex, which is why it is mostly done in labs. And it's complex for multiple reasons, but one of the biggest is that blood is not actually the sample they test. They separate the liquid part of the blood from the cells, which is called plasma. And that plasma is what goes into all the FDA-cleared tests that we all use or our doctors prescribe. That's why blood testing has only been possible in labs so far, even those swabs we can do ourselves. So really, what Gattaca has done, and I've been in this space for quite some time, which is what attracted me to them, is it's the first and only conversion of that blood into plasma at home, which makes it a sample that's ready to test. You can do it at home pretty easily. It's passive, so there's no battery power, no electricity, no fancy gadget to use. It's a very simple capillary action, and either you can test at home in the future, or today you can just mail that sample in, just like we all learn how to mail samples in with PCR, and you can do blood testing without leaving your home. So there's a little picture of the product there, but the next slide, will go down a little fast, is a little video of how easy it is. You literally finger stick, which we know for glucose testing people can do, and you touch it to the device. And the device does the rest by itself. It'll take that blood, as you can see with the animation, plasma comes out, and somebody just dispenses that liquid plasma into a little vial, and you can ship it. And again, in future renditions, you can also test it right at home. So Gattaca's working both. So no equipment, simplicity, thank you, just stay there, as well as a lot of different IP that came together. This has never been done before. It sounds simple now because those two geniuses over there figured out how to do it. But it's been very cute technology, and I'm here to basically figure out how to commercialize this, and that's what we're working on. So if you go to the next slide, this is where we're talking about markets. What could you do with this? Well, we all know about the COVID antibodies. Actually, most of our team informally knows what our vaccination levels are as they go up or down with booster shots as the time goes by. So a lot of antibody testing. My own daughter has been diagnosed with celiac, and she has to go in every 2 weeks to detect antibodies to gluten. A 12-year-old doesn't like to get her blood drawn every 2 weeks, and we don't need it. Most of that blood goes to waste. A little drop of blood can go a long way, and which is where all these different types of, in the previous talk we were talking about chronic fatigue syndrome, same thing, there are antibodies that you're testing that can be done easily and simply and cheaply, hopefully. Same thing with certain infectious diseases, autoimmune diseases, as well as, of course, allergy type testing. So a bunch of different areas that we're looking at. We are working with some major collaborators to move forward in certain areas. We're not going to conquer the world, but we're going to showcase this in a few different areas. And we have some good investors now. We have collaboration with hospitals like Cedars-Sinai up in LA that are providing data to validate this technology. So if you go to the next slide, this is where we are as a company. We raised some money as I came in. We started our product development efforts. This year, our big focus, we already have a couple of commercial deals with some big partners. So actually the #1 player in COVID antibody testing is our customer. So we're scaling up manufacturing as well as validation testing. We're going to be launching the first generation product at a national conference in Chicago. So really taking it out there and letting the market basically kind of test it in a research setting initially, but of course then slowly going towards the clinical side. And then we need to raise more money just to commercialize. So that cycle will repeat. But in terms of the first proof point, I think the technology has been converted into a product that we think we can start marketing. And rest, we'll see how it evolves. So thanks for having us here.
And next up, we have John Powers again. I lost my sheet. I wasn't just disappearing. Oh, I guess I could have looked right there. SimpleSeq, John Powers, here we go.
Excellent. Well, now I'll go into SimpleSeq, which is one of the incubator companies. And if I'm yelling, they turn the microphone up now, so I know I'm close. So no molecule left behind. This is actually a mantra that came from a discussion between our CSO and our president, as they're looking at what's our goal, what do we want to accomplish in this, with this technology we've invented. And it's really no molecule left behind. Specifically what we're talking about is DNA and RNA molecules. So we're looking at what's typically called the nucleotides. And when you do sequencing today, there's gaps and omissions when they do the testing. So when they talk about how deep they sequence, it's because you don't get a perfect read. So having the goal of no molecule left behind, it's a pretty lofty goal. And we believe that, we know that with our IP, we can eliminate a lot of those gaps and a lot of the omissions. We're not going to achieve the goal of no molecule left behind, but that's why we're doing more testing and continue to research and continue to work on our IP, because we want to have the best product out there that makes a difference. So who is SimpleSeq? SimpleSeq was founded in 2019, and it was founded by the same founders that opened Myriad Genomics. So it's myself, Jay Goth, and Brandon Young. And what our goal was in SimpleSeq is focus on expanding and the use and efficiency of genomic testing. So when we look at the frustration, Brandon Young, who was our CSO, he was frustrated with the high complexity and really all the sample prep process, all the problems that you ran into is a high cost, high complexity, and he came up with a better way. So with our enzymatic approach to this, what we do is we've got a core patent based on the new way that Brandon developed. So with this method, we know that we can make much different changes on the front end of the process. When we talk about the front end of the process, it's the nucleic acid extraction through library preparation. And that core patent really led us to start looking at that whole string of events. From there, we came up with 4 additional patents. And those 4 patents really build onto how to run this business and how to make everyone out there that does NGS testing to do it better, faster, and cheaper than they do it today. When you look at any new business, you say, what do you want to do? You want to be better, faster, and cheaper. And we used to say when I was in a former industry, well, the best way is if you can come up with 2 of those, you've got a winning product. So we know that with all of our IP, in any of these given steps, it's going to meet 2 of those. It's going to be either better or faster or cheaper, at least 2 of those. And for the whole process, we think that we can be actually all 3. We can hit a trifecta. If we look at the market, right now everybody's seeing the market's been fairly volatile. The genomics market is a $26 billion market in 2022, and it's had compounded growth of double-digit for the previous 10 years, and it's forecasted at 15.5% compounded annual growth through 2028. We know it's a strong marketplace. And we look at activity in the marketplace. In the last 60 to 90 days, there have been over $1 billion invested specifically in next-generation sequencing businesses. So we know it's a strong place to be, and we know it's where we want to be. When we look at where we're going, we've got a strong team that's dedicated to really, we think we can deliver on our promise. We added a president just recently, so I'd like to welcome and really appreciate Bill Biggs that just joined us. Bill is an excellent scientist. He's worked commercial labs, he worked research labs. He's taken products from inception through commercialization, very strong both at the C level and the lab level. Combining with Brandon Young, we have a phenomenal scientific, really kind of leadership within the company. And on top of that, Dr. John Spinoza brings the clinical benefits. And when you look at the combination of the business and the operations experience for myself and the other co-founder, Jay Goff, we know we've got the team that can deliver on this. So I want to thank you all very much and look forward to seeing you guys after you eat.
And before our next speaker comes up, I want to make a quick comment. We have one more dignitary in the room that we didn't recognize, and the city of Murrieta cannot stand to not have that person recognized. It is Kimberly Davidson, who is sitting here all bashful and shy, but in reality, she lit the torch that became the Murrieta Innovation Center, and after being arrested for arson, she got out and continued to push innovation in our valley. So we're very happy with all the work that Kim has done for this valley. Thank you, Kim. And next up is somebody who's going to be very humble, but in reality, the Riverside County Innovation Month is an event that's went on for 6 years. And it started with the goal of showcasing innovation in our valley. There are 6 competitions throughout the county. Each one has a series of pitch presenters. Each one has a winner. The winner is set up in a head-to-head finale at the end of the month where you become the greatest startup in the county of Riverside. And this year, Rebecca from Swelter won that award. So, Swelter.
I'm Rebecca Owens, the founder and CEO of Swelter. Swelter is an emerging healthcare technology platform that is on a mission to ensure that every cancer patient and their physicians are receiving and have access to education and testing and treatment opportunities at the most critical times in decision-making. Beyond my 22 years of experience in cancer diagnostics, I have personally been impacted by this awful disease. On February 17th of this year, I lost my father-in-law to stage 4 melanoma. At a terminal diagnosis, he was told that he had 3 months to live with an inconclusive radiology image. I don't know about you, but I believe that we had to look for other options. Because of my background in cancer testing, I was able to get him a novel test that would, 1, tell us whether or not he did have melanoma in the brain, and 2, present us with potential treatment opportunities and/or clinical trials. Every person that you see on my screen is a close family member of mine and a friend who have suffered and gone through the exact same stories as my father-in-law. Although we lost him on February 17th, I can tell you that we got 14 months with him instead of 3. We are comprised of a leadership team with more than 60 years of combined experience, specifically in healthcare informatics, real-world data, cancer diagnostics, cancer care, and user experience. We have launched some of the most innovative strategies and solutions at some of the leading companies in our space. So let's really address the real problem. More than 17 million people are living with cancer in the United States, and more than 1.7, actually now the statistics are more than 1.9 million, cancer patients will be diagnosed each year with cancer. And what will shock you is more than 60% of cancer patients are not receiving the appropriate testing that could determine their best treatment options or guide them to a clinical trial. Additionally, the methods that we're currently using to educate patients and physicians about these very complex therapies and tests are costly, outdated, and quite honestly, ineffective. You can think about the commercials you see on TV that most of us are probably scared about, the side effects, and they're just too much for the companies to continue to spend and continue to be ineffective. So how is Swelter addressing this? Swelter is a web-enabled, mobile-friendly application that is encountered at the oncology first visit, and we present the patient, through patient consent, the most optimized treatments and testing opportunities relevant to what is in their medical record. But we also know from our experience, you cannot just educate a patient. You have to educate simultaneously the clinical staff and the oncologist. We have to drive additional insights that must be leveraged, that cannot be seen or utilized in their medical record. And we also have to be able to help the clinic and the physicians turn these insights into action. But where our innovation lies, many people have encountered what we call patient engagement applications, which require a patient's input into a mobile app. But on the far left of my screen is where our innovation lies. We leverage the medical record, the database, in real time, again, leveraging patient consent alongside their physicians, and we dynamically inform the app. As the information in your medical record changes, we inform the application. Just like my father-in-law, he would have learned about that novel test if he had our application. The healthcare technology landscape is exploding thanks to COVID, and we have seized the opportunity to build this application, and we do believe that we have an opportunity to achieve $100 million in market share. How we make money is by a subscription-based model. The people who are most qualified to tell you about a test or a treatment are the pharmaceutical companies and the laboratories who develop these tests. So we developed a subscription-based model where they deliver their patient-facing education and the clinic-facing education through our application. Thank you for your time and the opportunity to present to you. I am available for questions after the show.
And you may think that he runs every business in the Innovation Center, but Jay Goth is actually here just representing some people who might not be in town today. So up representing Parthen is Jay Goth.
I want to talk to you about something that really resonates with the last presentation. Rebecca is going after cancer patients, trying to help them through education, consent, community, and we're doing basically the same thing. We're just kind of taking another angle. So basically, what Parthen wants to do is reimagine medical care. Right now, like she said, very few people actually get genetic testing when they're diagnosed with cancer. It's not until they get into the later stages that they even look at molecular treatments. We want to change that. We want everyone to get tested at their first diagnosis or even beforehand if they see a fuzzy image, whatever. And we really want the patient to take more control over their journey. The whole idea is, it's my life, it's my illness, I want to have more say in what I have going on with me. And then we want to surround them with a community of caring. We want to give them an opportunity to hear from other people who have been diagnosed with the same disease. So genomically guided therapies can drastically improve survival rates. Why aren't we doing it? Well, number one, it's a pretty new technology, so a lot of doctors aren't up to speed on it. It's still pretty expensive, even though the cost of genomic sequencing has dropped substantially. There's a lack of knowledge, as Rebecca pointed out. People just don't know that this is even available. And then you get into reimbursement issues. You know, you've got to deal with the insurance companies and the people who actually pay for these tests. We want to get around all that. What we want to do is give the patient access to their own data and help them make their own choices. We want to make it secure, but we want to make it portable so that they can share their data with the people they want to, whether it's their oncologist or maybe a second opinion oncologist. We want to provide expert help, and we have some of the top oncologists who have been working in this area since the beginning of genomically guided treatments running this business. And we want to give them that community support. So guess what? There is an app for that. We partnered with a company up in Canada called Xamplo. And Zamplo has created a end-to-end solution where patients can go in, they can upload their data, they can share it with who they want to. It's totally HIPAA safe, it's very secure, and it gives them access to that community of people. So what we're doing is we're taking a nonprofit approach to this. We are creating the Parthen Institute for Transformative Oncology at the National Foundation for Cancer Research. So we've partnered up with an international cancer nonprofit to offer this to people and actually, through the nonprofit, subsidize the cost of this testing so that everyone can get tested. And that way we can expand precision medicine to everybody, which is what we want to do. Our founder is Dr. Brian Leland Jones. He couldn't be here today, but I've known him for many years. He's just a dynamic, mission-driven individual. This is his legacy project. This is all he wants to do, and he's going to drive this to success.
Thank you, Jay. So now I believe we're going to get technologically adept for you again, and we have a video presentation from Marty Kaiser of IV Bioholdings, and here we go.
Hi, my name is Marty Kaiser. I'm the founder and CEO of IV Bioholdings. My job today is to share our story with you in 4 minutes or less. IVBH started as an idea fueled by an optimistic vision that healthcare could and should be so much better, and a fundamental belief that creating new circumstances could lead to new and far better outcomes. It was this vision that fueled us to rethink business models, reinvent research and development processes, and rethink the patient experience, all with the goal of finding ways to detect disease earlier, diagnose it easier, and treat it more precisely than has ever been done before. Our platform company is defined by 3 things: speed, efficiency, and risk management, made possible by advanced data science and exponential technologies, and a decentralized business model that prioritizes people and partnerships to rapidly accelerate growth. Over the last 3 years, we've conceived, created, and scaled 3 companies: Liquid Lung, focused on pulmonary disease; HepGene, focused on metabolic disease; and Mammogen, focused on women's health. And we've completed 165 advanced research and development studies across 14 human data sets. And as early adopters of RNA technology, we currently control the intellectual property for non-invasive early detection of disease in 3 of the largest disease areas in the world: lung cancer, liver disease, and breast cancer. Today, we are more than an idea. Today, we are an established bioplatform technology company with 8 clinical stage diagnostics in development, having achieved best-in-class accuracy across all stages of disease, including stage 1, where it counts. Our leadership team consists of a diverse group of leaders with multidisciplinary expertise and a proven track record of value creation and execution. Behind us is a global network of institutional talent comprising 3 molecular managers, 9 data scientists, 4 software engineers, a diagnostic program manager, a head of quality and regulatory affairs, and a world-class scientific advisory board of key opinion leaders in all the relevant domains, and 7 CLIA-certified labs across the US with defined channels to market in specialty oncology, gastroenterology, and women's health. Today, we are establishing a completely new standard in integrative diagnostics, intentionally designing non-invasive tests that rule more of the right people into imaging and intervention earlier, and ruling more of the wrong people out of completely unnecessary procedures. Today, we're on the doorstep of 3 extremely major inflections and milestones. This fall, we'll be deploying our first PCR tests into clinical utility trials, followed by our first publication, and one step closer to our first live saved. What we've been able to achieve up to this point should have taken 7 to 10 years and cost $100 million to $700 million in research and development spending. And we were able to achieve this in less than 3 years on less than $5 million of raised and deployed capital. Today, we are leaders in early detection precision diagnostics, and I would go as far to say that new circumstances have been created, new outcomes have been achieved, and we're just getting started. Thank you very much.
And who would have thought we're already 73% done with our presentations for this night? We are just rolling right along this evening. Next up, we have Epigenetics RX, and Deb Hubers, come on up.
So 16 years ago, I had to have a hysterectomy. And because of my managed care background, I realized that hysterectomies were one of the most abused surgeries that are ever prescribed. So I had actually 3 second opinions. And what I learned is that I actually had to have a hysterectomy. But more importantly, what I learned through the research was that the drugs women take after they have a hysterectomy and for menopause vary greatly. And I was convinced 2 of my mom's best friends died of breast cancer because of unopposed estrogen therapy. So I decided to put my money where my mouth was. I sold my ski condo and I started a company to help women in their menopausal journey, which has morphed into a personalized DNA-based women's health and wellness platform where people are allowed to express their best DNA. Now the problem is really something that if you're a hormonal woman, you might have encouraged or you might have experienced these crazy things that sometimes we call the menopausal dwarfs, sometimes known as itchy, bitchy, sweaty, sleepy, and then also bloated, and then of course psycho. So obviously that's not something you young girls want to look towards, but since I just turned 65, I can tell you that I've been dealing with it for obviously 16 years. And the good news is there are solutions. So one of the things that we're very excited about is our solutions create life-saving results. And what I can tell you is there isn't a week that goes by that someone doesn't come in and say, "You changed my life." So what really is rewarding is that we are changing lives, and one of the things that we do that makes our solutions unique is that they're based on personalized medicine. So what we do is they're based on several genetic tests that we do and other biomarkers, but thousands of tests that we've done with hundreds of physicians. And what's exciting is that our physicians perform 500 times better in their managed care matrix. And over 50% of our patients actually are on auto ship, demonstrating the success of our program. 80% of our revenue comes from this target market, and even though we take insurance, 90% of our revenue comes from cash. Our target market is women 35 to 65 years old. They're college educated. They have a household income of over $100,000, and they're experiencing hormonal symptoms. Our treatment categories fall into 3 major categories: cognitive or mental health, sleep disorders, or women with hormonal symptoms. And why are we so excited about perimenopause and menopause? If you've ever gone through it, you'd be going, why are you excited? Well, it's a huge unmet need, and it's a $600 billion opportunity, and less than 5% of the femtech investments are in perimenopause and menopause. We have a proven business model. We have 25,000 patients and 2,500 providers. We have published IRB and 2 studies and 2 patents. We have revenue from our online platform. We have done over 35,000 tests with Marietta Genomics, and we have over 19,000 prescription personalized formulations. We have an exclusive with the 5th largest hospital system in the United States, and we have a big network of practitioners in targeted therapeutics. So thank you for your time. If you'd like to learn more about our digital pharmacy, give me a call. Thank you very much.
So I've been waiting all night to say this. Next up, Burble.
So 3 years ago, 2 years after I started this company, I found myself at Loma Linda seeing Dr. Fogel, who's the head of neuropsychology. I went through 3 months of testing with a PhD student assigned to me, and I found out that I was pretty decent on the IQ scale and pretty good on the working memory and pretty good on the visual memory. But I was 1/16th of a percentile on audio memory. So I was told that since my birth, I was basically heavily disabled when it came to academics. But as you could tell here, it has not held me back. So coming out of the Navy's highest think tank, I decided that I wanted to revolutionize the way we tell stories. I found that virtual reality, augmented reality, even movies, is taking the creativity out of the listener and basically just shoving the creativity of the inventor or the person that designed the story down onto you. There's no way that you can add your own creativity to these new platforms. So I set out to figure out a new way to tell stories, and in doing so, I figured out that there's a whole bunch of people like me that are going to benefit from that type of storytelling.
Sleep is a critical issue for many children on the autism spectrum, and technology only adds to this problem. Bright screens, harsh noises, and any number of devices are consistent sources of disruption before bedtime, making sleep near impossible. That's why Burble has created Ava, to assist children on the spectrum with falling and staying asleep. Ava is an immersive storytelling tent. Through the timeless tradition of storytelling and the careful use of modern technology, Ava is a space where a parent and child can immerse themselves in stories they create. In doing so, children will find a space they can relax in, one that feels welcoming and familiar because it's one they create. Ultimately, this leads to increased relaxation and tiredness before bedtime, leading to more and better quality sleep.
My oldest son is on the autism spectrum, and it would be something that he would love because it could be his own place, that he could use his own imagination and really just make it his own, and I really, really like that.
It's a great idea. With the direction of where the world's going, this is a great way to bring imagination back into a child's mind.
All of this is achieved through Burble's key technological and conceptual innovation, Minimally Defined Immersion, or MDI for short. MDI is the careful use of non-specific storytelling elements which leave many character, setting, and other descriptive details open for the child to imagine themselves, as well as diffused light and sound, synchronized to key moments in the story which offer an immersive experience without overstimulation. Ava is the first key product from Burble, which brings multi-sensory therapy to the daily activities of children with autism. Ava specifically is aimed at increasing the duration and quality of sleep through the use of MDI technology. With the continued development of this and other multi-sensory therapy solutions, Burble seeks to make the world a friendlier, more welcoming, and easier place for those on the spectrum to navigate.
So what you saw there was about 5 years of me having a blast with kids. I have told millions of stories. So just like most inventors, I maxed out every credit card I had back in 2016 and bought as much play type ability I did. We took over a playhouse in downtown LA in the Arts District and started revolutionizing the way we told stories. We started with Bernstein Bears. Papa Bear fell in the water, splash, it was horrible. My daughter came in and designed a new story, and the first time we all heard it with all the lights and sounds going, everybody imagined something totally different. That was the birth of MDI, Minimally Defined Immersion. Going into 2017, we sent 25 of those tiny tents out to every autistic kid we could out of a neurodevelopmental center, and we got beta testing and we did a full efficacy test. In 2019, we got a patent. We went into public access at the Bournes Youth Innovation Center in Riverside, where you could go see this right now, and every Wednesday is Autism Day, where kids come in and read stories all day long. We got our trademark in 22. And now I'm about to show you the next product that we've got that is going to be very exciting, and that's where we're headed now. We're going to have 1,000 of them by Q4. So this is a bedtime ritual change for kids with autism. So we are building a tent that goes over their bed that doesn't put the technology in the child's hand. So that child will go pick a book from their bookshelf, and it'll be color-coded, and that book, as soon as it enters their bed environment, it'll start reading them that book. At the end of reading their book, it will go into a calming environment that will match that book's style. So that kid can go to sleep and stay to sleep. With the average kid with autism sleeping for only 2 hours, this is a massive improvement. The price point is zeros off of everything else that's provided for kids with autism. Autism is where we are starting. We are soon going to move into kids reading, and this company is just going to take off. With that, I just invite anybody to come make some money with me and follow this amazing path as we go forward. We are in the public. You can go see it, and we're going to have 1,000 of these out by the end of the year. And we have beta testing every Friday with kids with families with autism. And this is a fascinating company to be in charge of. Thank you.
And now we come to our last presenter of the evening. It's once again Jay Goth. Tonight he's going to be presenting for Nomogen DX.
So what I want to talk to you today about with Novogen is the idea of clinical genomic sequence testing. So right now, there are some very large companies out there that are doing genomic sequencing testing. And basically what they're doing is they're using what we call research use only. They're not FDA-approved, clinically validated methods of obtaining results. And especially, you've heard a lot about non-invasive testing. It's called liquid biopsy, where instead of taking like a piece of a tumor and analyzing it, you can take blood from a person and then go ahead and test the DNA. And liquid biopsies are a vastly growing market. It's a new area, but the whole problem is we need reproducibility. We need to actually get to a clinical NGS. We need to get something that works the same time every time. So that's our approach, clinical NGS. It's not about throughput. It's not about how many genes you can identify. It's not about how many mutations. It's looking for specific answers to specific questions, getting the right answers in the hands of the doctors in a clinically validated model that'll actually give them the answers they need to guide the next therapy. We want 20 out of 20 samples to be exactly the same. We don't want 12 out of 20 or 16 out of 20, which is what the industry is seeing right now. So we've developed some intellectual property along these lines. We've got our chemistry patent has been allowed. It hasn't been issued yet, but the chemistry is the stuff that makes the whole thing happen inside the machine. But then we actually are building a brand new machine. This is going to be different from anything that's on the market. It's an out-of-the-box idea. And the whole design has been done, and now we're about to go into prototype. And what we want to do is identify multiple assays that can be designed for actual clinical utility. Our market approach is very simple. Right now, we can use CLIA-certified testing to get reimbursement and to generate income off of our assays. But the long run, the moonshot that we're really going for is a clinically validated, FDA-approved machine and tests that can be done in a doctor's office. So, there's a lot of activity in this space. A company just came out of stealth mode a couple weeks ago, Ultima Genomics. They created a new genomic sequencing platform. They came out of stealth with $600 million in their pocket. That's pretty nice. Singular Genomics also created a new genomic sequencing platform. They IPO'd last year at $258 million. Grail is in the liquid biopsy business. They were acquired by Illumina for over $7 billion. So there's a lot of money being spent in this area. What we want to do is heal more people. We want to be the FDA-regulated go-to testing device in the clinic for people that are suffering from various diseases. We want to do it in an economical way. We want to offer these clinics and hospitals a complementary sequencer, give them the razor, and then sell them the razor blades. But the whole idea is make those razor blades very inexpensive, easy to use, and again, the difference maker in this is clinically validated. So Yan Wang is the founder. This isn't her first rodeo. She created a new real-time PCR machine that is currently, has been developed, has been prototyped, and is in the process of being sold to a larger group. I'm the interim CEO. I'm working with Yan on developing the business model. Yan's been working with Steve and Phil at the Scripps Genomics Core for several years. She's actually had her own employees working in the core with Steve and Phil, and they provide all the experience and background and testing that she needs for the genomic side. Her engineering team is in San Diego, and this a group I met. They're amazing. They do everything from designing the circuit boards to building the actual machines. They're a fully designed team. And when they designed her first RT-PCR machine, they built it inside out. It was amazing. I took a look at this. It looked like a hydra. It had all these wires coming out of it and everything. but they had put all the components on the outside of the machine, so as they were messing with the prototype, they could plug things in and plug things out without having to go open the case and get inside. These guys are geniuses, and they're the only end-to-end engineering lab, I think, in San Diego that could do something like what Jan's trying to do. So that's Nomogen. That's what we want to do. And I want to thank everyone for coming out tonight. We really appreciate you taking a look at some of the innovations. I think you can see the city of Murrieta has a real gem on its hands here.
Thank you all. I hope that when you watch these companies come up and present, you're starting to get a feel for what Riverside County is really all about. We are not one thing. We are not only logistics. We're not only retail. We're not only tourism. We've got a lot going on here, and I hope this showcase really helps to present that. And I would like to see if I could have our mayor, Mr. Jonathan Ingram, come up really quick and throw in his 2 cents on this.
So when I first heard about the MIC, the first thing that went through my mind 8 years ago was Star Trek. How many of you lived long enough to watch Star Trek? How many of you have one of these? So remember when they were talking in their hand, they're going, what is that thing they're flipping open and talking on? What we hold in our hand today has more power than the computer that sent the first rocket into orbit. The MIC is the industrial revolution of this generation for a multitude of reasons. As I was sitting and listening to everyone, the first thing that goes through my mind is targeted treatment. And God bless you, Epic, and not for the reason you might think, because I do have 5 sisters, 13 nieces, 2 daughters, 2 granddaughters. But I had brain surgery in 2003. I had a brain tumor. It took them 4 years to find it. They looked everywhere but where they should have been, because they kept saying it was in my head, and it truly was in my head. They removed my pituitary gland, and I'm on hormonal replacement. So trust me when I tell you I understand far greater than most might. And it's not only the unnecessary surgeries that someone may be subjected to, but the change of life for all of us, because menopause does exist, and most don't know that. When you talk to the average man, he doesn't know that you could be carrying the BRCA gene and have pectoral cancer. So as a society, when it comes to medical, and I've had this conversation with John, we're still dealing with Blockbuster, and the rest of the world is using Netflix, and we are the generation of innovation. It's a very important thing to look at today, and why? Targeted treatment becomes essential. It does, and if we can catch things early, the key to saving lives is preventative medicine. And to be able to have this access and have early access and to have these groups here is an amazing thing. But this is truly a village effort. Kimberly Davison sat in that building when the roof was leaking, and we were cleaning and putting things up with buckets. It started with the council members way before myself: Randon Lane, Rick Gibbs, Kelly Bennett, Alan Long, Bruce Coleman. So many people that saw this vision. And I was like, what are they seeing that I'm not seeing? And to see what's come to fruition in less than a decade, it's encouraging to see what's going to happen over the next 10 years. I can't imagine. And it reminds me when I kept thinking, what was Gene Roddenberry thinking when he had somebody scanning somebody on a table? And look at what we have today. We have that technology. And that came from visionaries. That came from people that dreamed. And that's what we need again. When I compare this to the Industrial Revolution, a lot of times we go, we're not producing what we did in our country anymore. Well, 3D printing changed the Industrial Revolution forever, because we can produce anywhere in the world. But the one thing we have the greatest minds in the world in our country, and we got some pretty darn good minds here in Murrieta. So God bless you, keep up the great work, and I look forward to working with you and see what you achieve, because I can't imagine what we're going to be able to do when I'm sitting in a wheelchair rolling around screaming at my grandkids and people. So thank you. God bless you.
And there's no better way to introduce our next speaker, who is the keynote speaker tonight. As Director of California's Office of the Small Business Advocate inside the Governor's Office of Business and Economic Development, why do you people do this to your titles? Oh my goodness. GoBiz, it's such a nice acronym. Tara Lynn Gray is focused on further developing the state's small business ecosystem and ensuring equity is front and center as she administers the small business programs for which she is responsible. Gray is a visionary, breaking new ground in non-traditional spaces, and is not afraid to ask the hard-hitting questions and engage in serious conversations to bring the governor's vision of a California all to fruition. Prior to her appointment by Governor Gavin Newsom, Gray was CEO of the Fresno Metro Black Chamber of Commerce and Chamber Foundation, a 20-year-old community-based organization where she engaged, educated, and empowered small business in California's Central Valley. She has been instrumental in the design and development of one of the most groundbreaking community-level mobility programs in the country. It goes on, but there's no better way to do this than to just bring Tara Lynn Gray up here, and it is Tara Lynn Gray, everybody.
So first of all, thank yous are in order. Thank you for the invitation to be with you all here this evening. Thank you to the city of Murrieta for your vision. And thank you, Mayor, for those remarks. They resonate with me. It's an honor to represent the Governor's Office of Business and Economic Development here this evening. For those that don't know me, there's a bio in there, but there's also a backstory. I am a native of California. I was born in Berkeley, raised in the Bay Area, which is where my parents settled after leaving California's Central Valley to go to college. They made the Bay Area home. As was said in my bio, I spent the 4 years immediately preceding my appointment by Governor Newsom working in Fresno, headquartered in Fresno, and working throughout the Central Valley. And it is where I learned more than I ever imagined about geographic disparity, about the gaps that exist in the systems that we have, and exactly how heavy a lift it really is to develop underdeveloped regions. I was appointed by the governor in March of 2021 and have just completed a little more than a year of service. I think I'm about 14 months now. Thank you. And during my tenure thus far, we've awarded 10 inclusive innovation hubs, 87 technical assistance centers. We've topped the $4 billion mark for our COVID relief grant program. We have launched the California Dream Fund. We have worked with the counties across the state to make micro grants available to our smallest and most vulnerable small businesses. And we've administered grants to California venues. And finally, at the end of this month, in just a few short weeks, my team will be launching the nonprofit performing arts program. So we've been a little busy, and there is a lot to do to support our state's 4.2 million small businesses. And why does all of this matter, right? Because California remains the epicenter of innovation, the epicenter of innovation capacity in the United States. We top the rankings. Actually, we don't just top them, we actually kind of dominate them, frankly, in the number of patents, in industry investment in R&D, in total number of venture capital dollars that land here, and in total IPOs. So says the Information Technology and Innovation Foundation in its latest report on the State New Economy Index. And this is because California remains home to what economists and Sunanet Score has called the transformational entrepreneur. We heard about transformation tonight in these presentations, transformation of the way children go to sleep, transformation in the terms of how cancer is detected and fought. And these entrepreneurs are focused in high growth and the production of intellectual property as the key indicators of their success. Sometimes they transform into unicorns. Sometimes they flame out. We get it all here. But the collective stories continue to power the growth of California's economy and to form our state's identity, reform it, reaffirm it, and to remain the home of the big thinkers, the risk takers, the innovators, and the nation's capital for change makers. Northern California's Silicon Valley, which we all know very well, remains one of the most successful industrial clusters ever created. We all know that, right? Starting in the 70s at Stanford University, professors and graduates founded high-tech startups, companies in the region surrounding the university, created really a hub that just grew and continued to expand. And over the past 5 years, the incomes in that region have grown faster than the national average, 14% and 9% respectively. And now other sectors are growing on top of Silicon Valley ecosystems, right? The green tech industry, advanced manufacturing, and life sciences, especially life sciences. The pandemic catapulted life sciences to the forefront of our economy, our public health strategies, and the public's imagination about what it's all about. Biotechnology, biopharmaceuticals, medical devices, equipment, research manufacturing, scientific research tools, right? Many of those things we heard about tonight. All of these professions aren't just people tucked away in lab coats in operating in obscurity anymore. They're front and center. They're making news on a regular basis, and we want to know. And I think what we discovered in the pandemic is, frankly, our scientists are indeed our protectors. They are uncovering systems, processes, creating tools, and teaching us all a new way to do things. And this industry countered many of the negatives, right, that devastated other leading sectors, such as leisure and hospitality. One such example is life science employment. According to the 2021 Biocom California Economic Impact Report, the economic impact of the life sciences industry was already significant, but now is growing exponentially due to the needs of the pandemic. In 2020, this industry produced 488,700 direct jobs, while California's total employment dropped by 7.4%. So life sciences actually during that time registered a 0.5% job gain. So if you include all the multiplier effects, life sciences was responsible for a total of 1.38 million jobs with total labor income of $131 billion in 2020 alone. And if we look deeper at that, 11,000 life science companies operated about 14,000 different establishments, including offices, laboratories, manufacturing facilities in California during 2020. National Institutes of Health awarded 10,904 grants in 2020 to California, equal to $5.55 billion. A sum of $686 million went to universities here, institutions, and companies for research projects that were all narrowly defined as life sciences. The total number of National Science Foundation awards to California equaled 1,452 in 2020, totaling $676 million while core life sciences funding summed up $431 million. You guys get where I am going with this, right? Venture capital directed to California's early stage innovators, like the ones we heard tonight, in life sciences soared more than 60% in 2020 to a record total of $15 billion. Right, I heard that. So I know that I stand between you and home, right? So before I leave you, I just want to remind us what makes an innovation cluster. What is needed to power this kind of success? Michael Porter, a Harvard business professor and leading business strategist, defined clusters as geographic concentrations of interconnected companies, specialized suppliers, service providers, firms in related industries, and associated institutions that compete but also collaborate. And I think I saw a slide or two with folks that are collaborating here. So all of these combine government, business, and public research is what is sometimes called the triple helix. And that's what we're seeing grow before our eyes right here in Southwest Riverside County in life sciences. Thanks in part to those change makers that are housed at the Murrieta Innovation Center with government support. And yes, that's why I'm here. So can we just imagine a future where Riverside is the geographic pole of the life sciences industry like Santa Clara is to semiconductors? I can. And while I know better than to attempt to predict the future, I do know that tonight we celebrate Murrieta's role in bringing some of those good jobs and new ideas right here to a community that needs it and is ready for it. I'm excited for you. I'm excited for what it means for our state, and frankly proud to be a witness of it. So I say, let's drop a pin in it. Innovation happens here. Thank you.
And with that, everybody, we're here to say thank you to our sponsors. Thank you to our presenters. Thank you to all of our attendees. Thank you to Dr. Gray. Please, if you haven't met one of the presenters tonight, go up and meet them, talk to them about their business. We would love to have you guys stay in network for as long as you like until 9 p.m. Then you got to get the heck out. With that, have a great night. Thank you, everybody. Good night.